Welcome to the Reclaim Your Rise podcast. My name is Lauren Bongiorno, nationally board certified health coach and founder and CEO of Risely Health, where we help people and families impacted by type 1 diabetes take ownership over their lives so that they can transform with more freedom and confidence. Everyone has a different reason to be here. You might be seeking knowledge, support, or community, but at your core, I know that you long for something deeper. You're here for transformation. And that's what the Reclaim Your Rise podcast is all about.
That's really important too, like recognizing, I actually may be really grumpy right now because my blood sugar is out of range and this is my grumpy space. And so how do I care for myself and also communicate to the people around me that that's what's going on? Having a family member ask, are you okay? What can I do for you right now? Sometimes just that verbal input is too much for us. And so it's okay to agree on emojis or a nonverbal cue of some sort.
A quick reminder before we start the show that nothing you hear on the Reclaim Your Rise podcast should be a substitute for personalized professional medical advice. Please always consult your physician or other medical professional before making any changes to your diet, insulin dosages, or healthcare plan. Hello, everyone, and welcome back to Reclaim Your Rise. I am really excited to share today's guest and episode with you. Today, I have Brea Di Dato on the show, who is a dual board certified and licensed family and psychiatric nurse practitioner in Oregon, and who was diagnosed with type 1 diabetes at age 38. In this episode, we talk a lot about the connection between blood sugars and cognitive function, diabetes distress and burnout, getting diagnosed as an adult, navigating anxiety that is heavily present for many people during the first year of diagnosis, and that can persist for many years after. Brea's experience with neuropathy and tips for how to communicate with your family and friends what you need for them when your blood sugar is high or low. That part was one of my favorites of everything that we talked about today. So there's something for everyone in this episode, and Brea has a lot to share. So without further ado, help me welcome my guest today, Brea, and let's rise. Brea, hello. Thank you so much for joining me today.
So glad to be here.
Yay. So let's dive right into the anchor question that we ask all guests. I think it's a great question to just use as a launch pad for the rest of the conversation. And that is, can you share a story of a time that you reclaimed your rise with type 1 diabetes? So a time where you really felt like you rose above the challenges, the limitations that diabetes tends to want to put on us sometimes.
Just one story, I think, is actually harder to select. I think for me, learning how to continue to mountain bike after I was diagnosed was one of the big wins, because the anxiety that comes with a new diagnosis, learning how to dose insulin, exercise safely, and then mountain biking as a sport. You're really intensely doing cardio out in nature for hours, far away from people and resources. And learning how to confidently manage and feel safe when I'm out on the trail and engaging in that sport was something that I'm still to this day very proud of, and that I'm able to do it.
So for you, is exercise a big part of your life?
Absolutely. I think just from the nature of the work that I do, from how I grew up, getting outside and connecting with nature is something that really preserves my mental health and my physical health. And I'm not a massive athlete or anything. I'm a lady in my 40s, just mountain biking, hiking, skiing. I do it really just for the joy of forcing me to be connected to nature and to myself and to the moment versus being so distracted by everything else in life. So yeah, it's a big part of my life.
That's one thing that I do see about people who live out west. I know you're in Oregon. It's just there's not a lot of limit on the age of the people who are active. Like you see when I love being in like Utah, Colorado, Arizona, and just the 7-year-olds on mountain bikes, like biking and hiking and all that. And you're like, you just don't get that on the East Coast. And I I think it's, to your point, such a health part of health and mental health as well, which we're going to talk about a lot today. So I think it's important, Brea, to go back a little bit to understand your diagnosis and what that looked like for you. So do you think you can share a little bit of that with us?
Yeah. So I was 38 when I was diagnosed. I was actually at the time working full time as a family nurse practitioner at a community health clinic in California. Very stressful job for anyone who's never done it. I was also in a doctoral program for my doctorate degree, and I was in a postmaster's program for psychiatry. My daughter was a senior in high school, and so, like, from a stress standpoint of life, very high stress, very busy. Started to notice pretty extreme weight loss pretty quickly, and didn't really think much of it at first. But I am a Midwestern gal genetically, and I never lose weight like that. So
Hmm.
it was interesting. I would buy pants, and like 2 weeks later, they would fit. And I was working with a bunch of other physicians and nurse practitioners, and at some point, they started to notice it too, that I was dropping weight really quickly. My other symptom was the brain fog was probably the most intense thing I'd ever experienced in my life. Um, and it was in my psychiatry rotation that I noticed I was having trouble focusing on words and comprehending things that people were saying to me. At one point, post lunch, I realized
Hmm.
there was a patient speaking to me, and I was like, are they speaking English? Because I can't, like, what they're saying to me was just like not penetrating. Lord only knows what my blood sugar was that day. Anyway, I finally went into my primary care and had blood work done, and was called the next week after being violently ill all weekend by my primary care's nurse to say, "Hey, you have diabetes. We want to make sure you're going to come into the office in a couple of days." And I didn't believe them, and I actually went into the lab and checked my glucose, and it was 458 or something that day. I was incredibly ill, and I was a great example of how people cannot make good decisions for themselves when they're so ill and need someone to be an advocate. So, even as a medical professional, I worked the rest of the day, got through my day, went home. I called out sick for the rest of the week because I knew I was going to need care. I knew I was a type 1 based on the blood work. And then I sat there, and I think it was like a day or two later, I called my doctor and said, "Hey, does somebody want to give me medicine? Like, my blood sugar is so high and I'm not getting any treatment. I should probably get some care." And they were like, "No, we'll just talk to you when you come in." And again,
Wow.
I'm a trained medical professional, but the decisions I was making with my blood sugar being so high, I couldn't make safe decisions for myself and had to rely on my team. Thankfully, I survived all of that stuff and got started on insulin and learned how to be a type 1 diabetic.
Oh, adult diagnoses, like, it's tough. Like, you have your life. Like, you're on your path, you have your life, you're like,
Hmm.
there's I didn't really, carve out time today to get diagnosed with type 1 diabetes. That wasn't, like, on the agenda of my calls. For you, did you what was the initial, like, even just, like, 6 months like for you? Or was there a time period where you felt like it was really hard and or did you kinda, like, did that happen faster for you because you had a medical professional, background? Was it like a month? Like, what was that time frame look like, and what was it like for you?
Well, yeah, get so my A1C at diagnosis was 14, and then my next A1C after that was like 5.8. I slammed my blood sugar down pretty quickly, not knowing also that that has a consequence, and I ended up with some treatment-induced neuropathy, which my own
Mm.
medical team didn't even know that what that was, and then I ended up looking it up and researching why my feet were in so much pain. So I was able to get to what would be considered like a well managed A1C and target at the time. But the consequence of it was I was terrified and exhausted and anxious because, as medical professionals, we understand what the complications are. And especially for someone like myself, I worked in hospitals, critical care, cardiology, oncology for years. And you see the worst of everything. And so you begin to believe that that will be your future when you get a diagnosis like this, not knowing that there's a whole lot of other options for what your life is going to look like. So the beginning, the first 6 months to a year, I think is the hardest, and I think that's true for most people because there's just such a huge learning curve, and I don't think there's any time that you get a type 1 diagnosis that is easy. The challenges that kids get versus adolescents, young adults, and are the more mature diagnoses. It's all hard. It's just hard in different ways.
I agree with that for sure. I was diagnosed at 7 years old, and it was,
Yeah.
it was easy when it happened, but then later on in life, when I realized I didn't process that diagnosis, like, then it became hard,
Hmm.
right? It's different for everybody and hard in to each one's ways. I want to go back to something that you said because we've never talked about it on the podcast before, and I get a lot of questions about it, which is neuropathy. So, do you think that you be open to sharing a little bit about your
Mhm.
experience with that, and what that's like, and what that is? It something that you reversed, or is there still like maintenance? But like, can you speak to that?
Yeah, yeah. Mine was treatment induced, so it was because I had reduced my blood sugar so quickly. It was incredibly uncomfortable. It did last for probably the first like 5 months. Really bad heel and bottom of my feet pain. When I would sit on the couch, I'd have to like elevate my feet because it would just help to not have anything on them, not having them touching anything. I think the challenge in the beginning was that it was happening, and I would talk to my medical team about it, and they would say, "Well, your A1C is fine. You can't be experiencing these symptoms," which, of course, is one of the challenges overall or the problems in our medical system is that unless a provider understands all of the nuances of the symptoms that someone is experiencing, they have a hard time validating the experience for people. And so you start to feel like, am I losing my mind because I'm having these symptoms or this experience? But this person tells me that it couldn't possibly be true. But thankfully, I have a lot of resources because I am a medical provider and found out what it was and how to manage it. And it did resolve over time. So I'm very lucky that it's not permanent because I know how uncomfortable it is.
How frustrating that is. I know we've all and everyone listening can relate where you've had that experience where you're going to somebody who is supposed to be helping you and have the answers, and you're the one having to advocate for yourself because you have this like
Hmm.
this deep belief that like, no, I know there's something wrong here, and like it's not nothing.
Hmm.
Would you say that the diagnosis has made you approach work with your patients differently? And if so, what way?
Yes. I hope that I'm a more empathetic and compassionate medical provider. I do know, and mental health provider. I do know that after my own diagnosis, I ended up reaching out to some of my previous primary care patients and apologized for some of the conversations that we had had because I just felt like there was so much misinformation and inappropriate information that we get taught as health professionals that is, it's based in statistics, and it's based in, how actuaries reimburse and manage payment to healthcare. It has nothing to do with like quality outcomes for people living with chronic illness. My hope is someday that we get better and have better conversations with people about managing diabetes. All types are really challenging for people. And understanding that things like a glucose number or an A1C or a time in range, these are all just data points that we need to be using to make informed decisions about how to care for ourselves in these moments, but that they are not a measure of our worth or our commitment or the sacrifices that we've already made to manage our health or to take care of ourselves. Uh, and there is an overemphasis all of the
Mm,
time in our health system about single data points. Oh, your
mm.
blood pressure is this. Oh, your body mass is this. Oh, your A1C is this. And it really minimizes the human experience and the suffering that they endure on a day to day basis. So I hope that I approach it better.
Well said, and I do think that just looking at the data, what it also does is it skips over people who are actually struggling, who can't reach out to say that they're struggling because on paper they look fine. So A1Cs of a 5 point, but in the fives,
Yeah.
oh, check, good. Let's fill your prescriptions next. Let's focus on the person who's quote unquote non-compliant and
Sure.
has high A1C. It's like, no, actually, like there's a story behind every number,
Yeah.
and that lived experience is really, important.
Yeah.
So
Absolutely.
for you, going back into your diagnosis journey, like what are the things that you feel helped you in the first, let's say, year of coping, grieving?
Mm.
Like if you were to look at yourself as a case study.
Mhm. Yeah. I think in the beginning, I learned a lot from the community. Uh, Thankfully, I do believe that I learned more from the actual community and community resources than from any of my like vetted medical information because it doesn't touch on the lived experience. I will say something that helped me was learning how to really take control of my anxiety. there's a lot of anxiety in the beginning. And I know I've talked to other people with diabetes who've mentioned the same, that I learned the importance of understanding how to ensure my safety so that I is explored how much insulin do I need? How am I going to do this activity? How am I going to manage this, meal at this restaurant? That just focus on being safe in the beginning. So, what are my numbers? Am I really at risk of DKA or am I at risk of having a low? If those things aren't occurring, I know that with tools and with time and breath work, like I can get through this and I can do this. And the more I pushed back against the anxiety and the fear and had the lived experiences, the more my confidence grew. And I continued to live my life, still interrupted by diabetes, but living it to the best of my capacity.
Hmm. That piece of anxiety is so real for people, in that, especially in that first year, but also if they
Yeah.
don't learn those tools around how to feel safe in their body, that persists, right? That can
Yeah.
persist into 10, 15, 20 years. And it really is that foundational first, let's say, year and chunk of time that if the tools are limited, a lot of people walk around like, what am I missing here? Because I just feel like I'm, blindly walking around with insulin on board and I really don't know what's going to happen. And
Right.
there's no predictability element to it.
Right.
So it's, it's around this scene that we're talking about. Really, what's coming up is advocating, right? Advocating for the
Right.
pieces that you're missing, the educational gaps, all of that. You being a dual board certified, family and psychiatric nurse practitioner, are there patients that you work with, like that have anxiety that you're like, is it anxiety, ADHD? Like, what are the challenges that come up that you also recognize come up largely in the diabetes community?
I do. So I do have local like endocrinologists and primary cares who will refer people to work with me, who are maybe are having some like burnout or distress, or they just want to work with somebody who knows what it's like to
Mm,
live with diabetes. Anxiety is a big barrier. It's huge at first diagnosis. So I do work with a lot of people who have just been diagnosed, adults, or supporting families of kiddos who've just been diagnosed. There is just so much like fear in the beginning because it's such a big change, and you're handed a medication that there's all of this fear around that too, right? Don't take too much, or there's a consequence that could be lethal. Don't, and if you don't take enough, you're going to end up in the hospital. And so as much as it's important for us to understand what those like safety thresholds are, we also don't want those to become barriers to living, right? And I see both things happen as a result. Like some people are so anxious that they're scared to engage in using their insulin, and it really limits, how their quality of their life experience. And then the other end of the spectrum, where people are so scared or anxious about having a medical complication from diabetes that they really want to have that tight, blood sugar range with that flat glucose line. And that affects their lived experience as well. Absolutely. And I think anytime, even when I'm working with people with other chronic conditions, cancers and whatnot, when we are living our life, making all of our decisions from a fear base, it's going to impact our ability to be fully present and to enjoy the life that we're in. There is a beautiful life with all of these chronic illnesses that we work with. It's understanding, how do I remain safe? What are my backup plans? And then not letting those things hold us back and still engage in life.
Yeah, it's perspective, right? And it's gratitude and trying to see where you can reach for that gratitude and where you can reach for the, not to be cheesy, but the, where the glass is half full, right? When you have somebody who is in a state of like darkness, right? Like somebody who is just like diabetes, like, I feel horrible and I can't believe this happened to me. And why can't I, just go about my day and not have to worry about this like my friends do, or like don't have to, or my family? Like, what is the first step that you take or you would take with somebody to move the needle closer to, away from those feelings of just darkness towards light, if you will?
I first always validate that experience for people because it is a grieving process that we have to go through. Um, Even when we're first diagnosed, or anytime we get another complication or there's a change, we're already working so hard that these things can be they can feel really overwhelming and they can feel devastating. So it's okay to cry and feel overwhelmed and feel like you've had your feet taken out from under you, because you did. I think over time, what we do is help people recognize that there is a beautiful life with diabetes or with other chronic illnesses. It's learning how to use your tools, create a really robust toolbox, and be flexible in those tools, and be flexible, in your plans. If we change plans, or need to make some type of a change incrementally, for whether it's pain or diabetes or sugar related, that it doesn't mean that we're failing at life, or that the experiences we are having aren't won't be full of joy and won't be full of pleasure. It just means that they're going to coexist together, and that's okay. And I see this for a lot of my clients that I work with for their mental health as well. Sometimes people have this idea in life that in order to be happy, that means the absence of suffering or the absence of sadness, and that's actually not true. Our minds and our bodies can experience pain and pleasure at the same time, just as we can experience joy and sadness. We can laugh and cry. And so, to help people understand and normalize that our bodies can have pain, our bodies can have disease, it doesn't mean that we can't reach goals, have joy, have laughter, have pleasure. We just need to allow ourselves to see it and permit it to come in. It's already there.
While you were talking, it reminds me I have a running list on my phone of just quotes, things I think of or things that I hear, or read other people say. And one that I wrote down recently is, if you expect life to be hard, living gets easier. And that really, resonated with me, because it's almost like, if you expect life there not to be struggle, there not to be challenges that come up health wise or anything, right? When that happens, it feels like you just got, hit by a truck versus, you know what? Like, I have overcome so many of challenges that have happened in the past, and, like, this is part of life. Challenges are part of life, and this is no different. Like, I can get to the other side of this, and that other side of it doesn't look like not having diabetes anymore, but it looks like living in harmony with it and not trying to forget it, avoid it, push it away, into a better relationship with it.
Yeah. Yeah. There's actually, I can't remember her name. There's a famous therapist, though, who talks about how to make sure we all have, really realistic expectations and goals for our mental health. And one of the things she talks about is, you can't have a dead person goal, right? And a dead person goal would be, well, I don't want to suffer in life anymore, because the absence of
Mm,
suffering is someone who's not alive. That's really the only
mm,
time when someone is alive and breathing that there is no suffering happening. And so we have to make sure that we understand, maybe I want my suffering to not last as long, or maybe I don't want it to be as intense, or maybe I want help recognizing the joy that's happening simultaneously with the suffering. But we can't have a goal of no suffering in life, because that's just part of the lived experience. It is actually a gift. It helps us recognize the good things that are happening in our life.
mm. And I don't know if you feel this way, but I feel like suffering and challenges are a mirror to the things that we have to work on, because it illuminates and magnifies the fears, or what feels uncomfortable, what
Hmm.
feels like it gives us anxiety, and it's like that is the next area to kind of grow into.
Hmm. Well, there is no growth without change, and there is no change that's comfortable, in all honesty. So what I help people, what especially when you talk about anxiety, because what happens to a lot of us is, you become anxious or fearful of something, and so you don't go to that dinner, or you don't go do that workout, or you don't try that new food, you don't go on that trip, you don't see that family member, right? And so our lived experience gets smaller and smaller and smaller, but the consequence of that is the anxiety continues to grow, because that is their dual relationship. And so if you shrink your living experience, the anxiety is continue to get so big that it takes over your life, and your lived experience is this. But if you learn to push back, be uncomfortable, it's okay to be uncomfortable doing these things, your lived experience will grow, and the anxiety over time will actually get better.
Oh, I love, love, love that analogy. I've never heard it said like that. I think how I've tended to think about it is, if you keep pushing down, pushing down, pushing down, it's almost like like a spring where it's eventually gonna pop back in the opposite direction, and when it
Right.
springs, that to me is when it overflows and you're beyond your emotional capacity and you're in that place of then burnout and that can't how do I now, like,
Yeah.
get back from this?
Yeah.
With the diabetes distress and burnout, um, in my experience and what we have found, working with hundreds of people in coaching and Risely is that it is such a spectrum and that there's nobody who lives with diabetes that doesn't have some sort of distress and anxiety, but there is a difference between people who have it in certain times, right? Like they're moving and they're getting married and they're, at the same time their technology is breaking and right and they're distressed and they feel overwhelmed and like diabetes, they can't do that. And that's temporary
Right.
versus people who have this underlying like you're talking about this anxiety, this the sense of it's a little bit more permanent, and then that also
Hmm.
scales to is it just like
Yeah.
what level are you distressed? Are you burnt out? Where are you at? So what has been your outlook on that piece?
Well, let me make sure I understand the question. So, are you asking what's the kind of the differentiator between typical diabetes distress, or is it anxiety or something else going on?
Yeah, like let's talk about distress and burnout in that piece and the differences and the spectrum of different people who can experience that.
So, distress and burnout happens to over half of people who are diagnosed with diabetes, any type. Uh, so we all can experience it at any time. We do know typically at first diagnosis, we tend to see it when there's another medical complication. We tend to see it, or another diagnosis, maybe a completely separate disease. Um, it can occur. Uh, I see also just in general, like life stressors. A lot of people are working really hard in our society, losing jobs, having family members that get sick, having children, that may need some additional support. Really anything. And I think it's not just like diabetes that gets us there necessarily. It's we all have like a stress threshold, and if when enough things kind of compound and happen, we've been pushed past our threshold and we just need to figure out how to get through that. Specifically for diabetes distress, I see the range too. Some of it is like treatment related. Some of it is that they need additional education and support, and really just more tools on how to manage the day-to-day life of diabetes. How to exercise and feel safe, how to eat that meal that they loved, how to sleep and feel safe, just kind of like the day to day activities of living with this, not understanding insulin, what they're using, its onset, its duration. So some of it is just like basic. Let's help you feel confident with information and how to manage through some of these situations. Some of it's like family or provider induced. They don't feel understood by their family or feel judged, or they don't feel like their provider team is supportive, they're struggling. There's a lot of reasons why people can get distressed, and it can happen at any time. I really just do an individual approach, helping people really. It takes me a little bit to get to know what's going on. And then we start to pick what I kind of call what's on fire. What do we need to put out today? Making sure you're functioning, you're going to work, you're able to eat meals, you're safe. And then we can start to pull through some of the other target issues that you have that weren't as big, but are still really bothering you in the long run.
Mhm. Yeah, all the challenges that you mentioned, it really ranges from more tactical, physical to the emotional
Yeah.
and the mental side, and I yeah, I'm surprised 50% is the number. I would actually think that it's higher than that. I think I have a skewed perception though, because obviously the people that I'm interacting with most or that our team is interacting with most are the ones reaching out for help, but it seems to us that most people are either in a stage of feeling lost or just like a cycle of frustration with their diabetes, and it varies in that degree. But yeah, I mean, there's also so much shame for people not reaching out for help, and I think that's something that I would love to talk to you about as well, which is you feel like, "Oh, I've had diabetes for 10, 20 years. This is either A, just how it should be, and nobody can really help me get better because this is diabetes is hard, or my doctor told me when I was diagnosed, like, yep, this is a challenge that you're just always going to have to deal with. And you have this idea that it can't be a different lived experience. Or B, I've had it for so long, or I'm a healthcare practitioner myself maybe, and I people come to me for advice, or I'm the caregiver, I take care of other people, like, I should be able to figure this out for myself. So, have you seen that the people that come to you or the people that you've interacted with diabetes also have been struggling for a while before reaching out for help?
Yeah, yes, I see both. I see some people who reach out right away and feel comfortable talking about it. I think it helps that I am a type 1 as well, so people feel a lot more
Mhm.
comfortable just coming in for the appointment when they hear, because there is a lot of gaslighting and stuff that still happens in our medical community, unfortunately. Sometimes that's its own barrier, especially if someone has a diagnosis of something that occurred, when they were in elementary school or an adolescent. It's a long time. It's a lifetime of getting exposed to some of the non-therapeutic conversations that can happen in a doctor's office. So, and I get that. I would say, just as I also work with a lot of people who have ADHD, I find when people are actually diagnosed at a younger age, a lot of their understanding of the diagnosis and the things that we use to help people manage is actually missing some pretty important information. Because when you're younger, you have parents and a medical team around you kind of managing and telling you what to do. And then you become a young adult. And like all of us, we don't really know what we're doing in our 20s. So it takes time to, learn stuff, but we're busy. Like as human beings, we're just so busy. Everybody's working so hard to pay their bills and pay their loans and all of that stuff. So there isn't always a lot of time to really dive into what else could be out there, learn about more insulins, learn about some other food techniques you could use, learn about other types of exercise. We're busy people. And so sometimes it just takes coming to somebody who specializes in it and does this all day long to be able to learn that stuff, because you don't want to spend 3 months on TikTok and Google trying to figure out how to help yourself.
Mhm. Yeah, no, absolutely, and there's 2 separate things I'm hearing. One is there's gaps that are missing during diagnosis because you can't shove everything down the person's or the family's throat, right? It's like it's I mean, it would be nice to have more of an extended, let's say, week-long educational boot camp, go to school, but at the same time, you're also processing so many emotions that I don't even know if they're, especially because people are honeymooning, if it would be applicable for them then to learn those things. It's more of the extended over the next, few years, and making sure that people are getting that information. And then also you talked about ADHD, which do you know, and I don't want to put you on the spot, but are there stats that, of adults living with ADHD, or like what percentages of people living with even diabetes have ADHD? Because I found that that is a really tough thing that people struggle with for when you have ADHD and type 1 diabetes, because type 1 is so much about decisions and making space to follow through and connecting the dots between this moment and an hour from now or 2 hours from now when I go to the gym, and what am I gonna do now? All of that.
Yeah, I do certainly have people who have both a diagnosis of ADHD and diabetes, type 1, type 2, some other ones. There is we always have to assess also the actual state of the diabetes that the person has, because there is a direct influence on cognitive performance with blood sugar. We know that blood sugar, when it's getting above 180, it's impacting our ability to form memory and our visual and auditory processing. And so we want to make sure that the any executive function or cognitive performance issues that we're seeing isn't because of the diabetes component. Like, how do we help this person regulate their sugar so that they are meeting their cognitive performance goals as well. But that doesn't mean that ADHD doesn't exist in people with type diabetes as well. And so then we're really helping people understand both. How do we help you with a neurodiverse brain? Remember to do the tasks that you need to do things in sequential order, not feel overwhelmed sensory wise, be able to meet those kind of like day-to-day goals, and emotional regulation, also big with diabetes, but also big with ADHD as well. There's a lot of emotional component there, so you really have to help both areas. And that's true with anybody else who has a diagnosis of ADHD and, like bipolar disorder. You really have to be targeting both things and managing both things for the best outcomes. But, people live really, again, great, fantastic lives with all of those diagnoses. So it's just giving them tools. I really help people. Like I find in my job, my approach is my role is to help educate people about what their options are. These are why we would choose this medication, because it's going to target serotonin. And this is what we know serotonin does for people. And you have symptoms that you're hoping to target. So that's what we're going to use. This is what we expect to see. This is what the risk is. And just give them, this is why we use this type of therapy. This is why we're going to talk about it this way. How do you feel? Is this something you're interested in? How do you feel about the risk? How do you feel about the benefit? The decision is ultimately yours. I'm just giving you the information to make an informed decision, because you are in charge of your health.
Absolutely. And to that point too, that other mental health challenges that come up with the anxiety and depression and, I'm sure a list of other things, but those are the top two that come to mind. That the blood sugars alone and just improving A1C, we found has enhanced a person's, mood and um, happiness when they're waking up in the morning, all of that. So it really does play a big role. And I used to think my numbers were crazy when I was a teenager, and I thought I was like a moody teenager who just wanted to sleep all day and just would get so irritable. And it was, yes, probably teenage things, but now that I look back, I'm like, oh my gosh, like so much of it was you were 400 and then you were 50 and then you were 300 and then you were 120 and then you were bouncing up
Yeah.
all over the place. And I feel it like now with my blood sugars. I don't know if you can feel this, but because my time and range and my standard deviation like is so tight, when I'm 190, I feel that headache, and it's not great because obviously, I do go to 190. It's not perfect, but it really does it's in a way good because to me it's like your body is adapted to feeling that sluggish, and it should feel sluggish at that number.
Yeah. Yeah, absolutely. I do get effects when my blood sugar is above 180. I start to get a headache. My
Mhm.
thoughts are slower. It was really interesting, for the scientific side of my brain, to see, to like feel the effects of glucose, when it's high, when it's low, when it's shifting really quickly in either direction. You read about things in textbooks and stuff, but to actually experience it is a whole different animal. So it's definitely taught me a lot about, which kind of is a gift for me, because I got this as an adult. And so when I talk to people about their cognitive performance and what blood glucose is doing, to their ability to even think or make decisions or control their emotions, for people who've had it since they were children, they don't know any different.
Mhm.
They don't know that that's not the way that other brains work, and that part of what's happening to them that they feel out of control about is that blood sugar that's shifting. And so being able to help them understand, you know, outside of risk and long-term complications and, safety, but to understand that you actually can have more control over your emotions and feel better about yourself physically and mentally if you're able to achieve a little bit more control. I don't ever want anyone to think like, oh, I need to have that flat line, really,
Mhm.
tight standard deviation. Our line moving is a good indicator that we're living, and that's okay. But knowing how to prevent those really big shifts in either direction, and also how to care for ourselves and be
Mhm.
self-forgiving and empathetic when it's happening, give ourselves space and time to recover. That's really important too, like recognizing, oh, I actually may be really grumpy right now because my blood sugar is out of range and this is my grumpy space. And so how do I care for myself and also communicate to the people around me that that's what's going on?
Oh, that's such a great little phrase. Did you say grumpy phase? Is that what you said?
Grumpy space.
Great grumpy space, grumpy phase,
Yeah.
grumpy space.
Yeah.
I love that. That's, a lot of times we have challenge communicating with our partners, like
Hmm.
how it feels, or our family members, how it feels, or we even have a hard time saying like, hey, my blood sugar, you're asking me to do 10 things right now. My blood sugar is high. Like I can do that, but I want to like punch you in the face right now. So can you,
Yep.
can you give me a half an hour? And that could be a fun, I don't know if fun's the right word, but like an interesting way to describe, or just like a language you can use. I'm saying you, meaning anybody who's listening right now, that
Yeah.
you can use for like partner or family, of like, hey, my new thing is like, I don't, maybe I'm not going to tell you what my blood sugar is, but my code word will kind of be, I'm in my grumpy place. Like, and
Yeah.
you just know, all right, give Lauren some space, or give whoever some
Mhm.
space.
Mhm.
That's so
Mhm.
good. Okay, I'll give
Yeah.
credit to you. I'm probably gonna use
Yeah.
that a lot, but I will be
Go for
like,
it.
"Go listen to the episode with Brea, and you'll understand what the grumpy place is."
Well, we also, I also help people do like nonverbal communication because, whether whatever's going on, there's all sorts of reasons why having a family member ask, "Are you okay? What can I do for you right now?" Sometimes just that verbal, like, input is too much for us. And so it's okay to agree on emojis or a nonverbal cue of some sort. Like, I'm going to send you my thumbs down emoji. That means wherever I am, leave me be, give me that 30 minutes, and you can kind of agree to it in your household what that looks like. But that's okay. It's okay to just share in a non-verbal way with each other how we're feeling and make a plan of like how to help, what I need in those moments and how you can support me. A lot of people think like, oh, you need to be there. They need my physical support. I need to help them talk through it. Sometimes we're incredibly supportive by not physically being present too. That's actually a way
Mhm.
we can show people we love each other, is to pull back a bit.
Mhm. Right, and it's also a plan that you can make ahead of time when you are in
Yes.
a non-grumpy place, right? So that you don't have to go through that when you're not feeling great, because I know that that's the case for me personally. Like, I want space more than anything when I'm low, and I just need like space and patience from my husband
Yeah.
and whoever's around me, and it takes and feels like it just takes so much effort in that moment to even just say like and explain, I have a high blood sugar, or my blood sugar is this, because you feel like there's going to be follow-up questions, or there's going to be you would need to exert more energy to explain yourself or what's going on. It's just easier sometimes to just not say anything, but then you're being grumpy and someone's just like, what is wrong with her? So
Yeah. 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 Yeah, I think it's hard too because as family members, we always want to care for each other, and sometimes we want to. When we see that there's a problem, I'm going to jump in. I'm going to help problem solve this with you. So it's usually in an effort of caring, like, what happened? Why is your blood sugar high? Or did too much insulin? And when it's happening, no, I don't want to talk about it.
right.
Just, I can care for myself. I'm safe. My husband is a very like engineering brain. And
Mm,
it was a hard transition for us because diabetes was never in our marriage, and it's its own entity. Right.
mm.
And so learning how to communicate and have a whole nother third person in your marriage, and how that affects my emotional stability and our communication. And my sweet, loving engineer brain husband would constantly want to ask, why did this happen, so we can make sure it never ever happens again. And I had to help him understand, I don't need you to fix this for me. I need you to show me love by giving me space. And so that's something we had to navigate over time.
Yeah, wow, I think that's gonna relate to a lot of people. Men in general, not to stereotype, but I do feel like, oh,
Yeah.
they really, a lot of people, a lot of husbands will wanna solve the problem, and with all love and kindness and good intent, but that's, not always what we need. I'm so glad we got to talk about the partner part, because that's not something that I had, planned for us to talk about, but I think a lot of people will appreciate. So, I feel like we touched on so much. We, talked about a bunch of different things, and I want to leave, if you can share with people who are in Oregon, like, where can they find you? How can they get connected with you? Potentially work with you if that makes sense. Where would you send them? Plug yourself.
Yeah. People can actually access my schedule just right from my website. So it's pbh.health. And I'm sure I can give you the link to share with people as well. I do take several major insurances, and I see people ages 10 and above. And I see people all over the state because my practice is primarily telehealth. So, and I always, even when my panel is full, I always try really hard to make room for anyone who's a diabetic looking for help.
Amazing. Well, we'll add you to our internal resource list for coaching members at Risely too, and we'll put all your links in the show notes. So anyone listening who is in Brea's area, you can click below, look in the show notes, and get connected. But thank you so much for just such a wonderful conversation, and for sharing your lived experience and professional experience with us. And yes, just appreciate you.
Yeah. Thanks for having me.
Thank you so much for being here with me today and listening to this episode of Reclaim Your Rise. to let us know that the episodes we're putting out are impactful and to help us get our street cred up and let everyone else know that this is something worthy of their time to listen to. Please leave a rating and review on our Apple Podcasts. Send the show to other people impacted by T1D or maybe even your doctor, and share it on social media tagging @Risley Health and @Lauren_Bongiorno. New episodes of Reclaim Your Rise come out every single Tuesday, so make sure you are subscribed to the podcast so that you never miss a beat. Thanks again for listening, and as always, remember, diabetes is a challenge that we did not choose, but one that we can rise above.